Hi, my name is Muthukumar Radhakrishnan, also known as Dr. Rad. I am a pulmonary critical care and interventional pulmonary physician at Baptist Health, Fort Smith. Robotic bronchoscopy is a game changer. I mean, Ion is one of the leading platforms, and it's a game changer in diagnosis and management of lung cancer. It helps us reach targets that you could not reach before with a good yield and minimal complication rates. Try to diagnose lung cancer in an early stage and treat it, which then improves prognosis overall. It's an outpatient procedure provided things go well, which most of the times it does, and it's done under general anesthesia, so they wouldn't feel anything. And once they go to sleep, we create a path, use a navigational platform and get to the nodule and biopsy. It goes through the tube, endotracheal tube into your airways, and then there is a navigational path that you create based on a CT that you have before, and that guides you as to where you need to go with the catheter. And then you biopsy it with tools, with needles and forceps, and then that goes to pathology. Most of the times there's a pathologist that may be able to come and look at a slide in the OR and give us a preliminary diagnosis, and then we get adequate biopsies that we need, and then we drive the scope back out, and the anesthesia team wakes the patient up and extubates, and then they go to recovery and they go home. So this helps us catch it earlier with a good diagnostic yield and minimal complications. So cancer puts everything together, and you could do an endobronchial ultrasound at the same time rather than having two procedures. So if somebody did a needle biopsy then from outside, then they would have to come back for staging if they needed it. So I do think, and it tends to catch because these nodules are small when you get them, and so they probably, if it is cancer, it may not have spread. Well, I think most of the people know that smoking is bad. We counsel, we try to help them get support, try to, help them through the process, because it's hard to quit, but it's essential to quit to help with symptom relief and to prevent disease progression, and also to prevent developing lung cancer and other diseases related to smoking.